This video is presented to you by Nibin Thomas
and Soufi. In this video, we will talk about what Alzheimer's disease is and the different stages it has, with more background info on how it starts and how it can be treated.
Alzheimer's disease is the most common type of dementia, which is a brain disorder that causes memory loss. This disease gradually destroys brain cells, which cause major malfunctions in the brain and how an individual acts over time.
This picture shows the difference between a healthy brain, which is on your left, meaning that the brain on the right is a brain that has advanced Alzheimer's disease. How does Alzheimer's disease begin, and what are the causes of it? Alzheimer's disease develops differently for every individual. What appears to have been noticed about people with Alzheimer's disease is that their brain begins to decay about a decade before the symptoms begin to show. Abnormal deposits of proteins from amyloid plaques and tau tangles throughout the brain, and once healthy neurons begin to work less efficiently. Over time, neurons lose their ability to function and communicate with each other, and eventually they die.
What are the symptoms of Alzheimer's disease? These symptoms include emotional behavior, personality, language, memory, perception, and thinking and judgment, cognitive skills. For emotional behavior or personality, a person with Alzheimer's suffers from rapid mood changes for no particular reason. The personality completely changes. For example, if they are a very athletic person, they become very lazy, where they sit for hours in one place and do absolutely nothing. Also, instead of being independent, they become very dependent on family members or whoever else is taking care of them. They begin to have problems with knowing how to bathe or even dress. For language, how you speak, people with Alzheimer's tend to speak very slowly. You don't comprehend language or actions very well. You have no judgmental opinions about anything. You begin to have to sense in anything, and you can't identify objects as easily either. For memory, a person begins to forget little details here and there very easily. It's not a matter of, I forgot my keys, but it is forgetting where you put them all the time. If you have loss of memory, it does not mean you have Alzheimer's. You could have a different type of dementia.
Early signs of Alzheimer's disease would be losing interest in things you've enjoyed all your life, misplacing items that you used to put in the same place on a regular basis, getting lost on familiar routes, and loss of social skills.
What are the treatments of Alzheimer's? Unfortunately, there are no treatments to Alzheimer's disease, and it worsens as a person grows older. There are some medicines that help decrease the severe stages of the disease, and the medication mostly helps to control aggressiveness or dangerous behavior that they could perform.
There are 7 stages to Alzheimer's disease. First stage is non-cognitive impairment. People in this stage experience no memory problems. The second stage is very mild decline. In this stage, a person might forget little things such as forgetting familiar words or where they put their car keys. The third stage is mild cognitive decline. Here, family members and friends begin to notice deficiencies. In this stage, the individual begins to forget family members' names and also forget new names that have been introduced to them. Also, losing or misplacing valuable items and difficulty performing in work settings, which is noticeable to others.
The fourth stage is moderate cognitive decline. At this stage, careful medical performances are done, which shows many deficiencies begin to occur. A few such as memory loss of recent events, difficulty performing challenging mental arithmetic such as counting backwards from 50s by 5s, difficulty managing complex tasks such as paying phone bills or managing finances, and finally, reduced memory of the individual's history. The fifth stage is moderately severe cognitive decline. Day-to-day assistance is required when a person is at this stage. The person at this stage during a medical interview may forget important details such as their address or telephone number, become confused on what day or week or even season it is. The sixth stage is severe cognitive decline. Memory difficulties begin to worsen at this stage, and the individual begins to change to another personality. They lose most of their memory, and they begin to not remember any older, very recent events. Need help with getting dressed without supervision. They might wear a shirt backwards using the bathroom. Forgetting the name of their spouse or the person that is taking care of them. Experience significant personality changes and behavioral symptoms, including suspiciousness and delusions. For example, believing that their caregiver is an imposter. Hallucinations, such as seeing or hearing things that are not really there, or compulsive repetitive behavior such as handwriting or tissue shredding, also getting lost. Finally, the seventh stage is very severe cognitive decline. This is the final stage where their individual losses of ability to speak, perform tasks, respond to their surroundings, or even do anything. An individual loses to their proper speech. Words become broken down, not sentence structure, and everything they say becomes very unclear. The individual would need personal assistance for eating or using the bathroom. Reflexes become normal and muscles grow rigid. The individual begins to have problems with smiling, sitting, holding themselves up, and even more. Also, severe memory loss as well.